painful, nasty experiences having health exams. Yet, scared the next time you go in. I totally get that. I'm that way, the dentist, I want that to be the case. So you have to acknowledge that these exams are difficult for patients. And if I were, as a patient, if you can, make sure before you get undressed, say, look, I've had some really negative experiences. I have a bleeding disorder. I've had pain before. I need you to walk me through and tell me what you're doing. And I'd like you to use the smallest speculum, please. It's okay. As long as you give people the why, okay? This is your anatomy. This is on the inside now, the vagina, the cervix, which is the lower part of the uterus, the uterine body itself, the fallopian tubes, and your ovaries, okay? These are the basics. And then here's your cervix. Now, what you can't see, and again, I don't know how there's a way to turn off lights, but the center of the cervix is a little redder than the outer part. The center of the cervix, especially in women before we go through menopause, has little glands on it, and glands are a little bit fragile compared to your skin on the outside. And so those glands can be a place where if you have a bleeding disorder with intercourse, you can have some bleeding from some place like the Bartholin's. No, Bartholin's glands. Oh wait,
Because I have bleed in that.
no, hang on. I think it's heavy. Is there a marker?
Okay.
I can draw that.
You want a hard pen or?
The biggest marker pen or the biggest thing. Oh, perfect. All right, here's the Bartholin's. Okay. Urethra, vagina, labia minor, which can also be out to here. Labia minor do not mean that they're all little tiny tucked inside. Labia come in all different shapes or sizes. It's called the labia library. You want some pictures of it. This is your majora, which is on the outer surface. A Bartholin's gland lives right in here. It's right at the entrance to the vagina, and it's what provides some lubricant, not most of it, but some during sex. Yeah, this is a little gland that sits right here, and if there's friction, because there's friction down there, people, when we have sex, if there's friction, it can cause swelling of the little duct there, and so it can sometimes close up, and you can get a cyst that forms in there, or sometimes you can get a little bleeding. They're not, they happen, and then you have to have them drained. Yeah.
Sorry, I tried to Google this and I couldn't find the answer, but I'm curious to after hysterectomy, when they take the uterus and the cervix out.
Yes.
And I know there's a cuff,
Vaginal cuff.
but they can still go in and reach your ovaries. How does that?
No, you
No.
can't, from the vagina side reach the ovaries after hysterectomy. So when we do a hysterectomy, we go, let me see if I can use this pointer. We go right. Hello, I'm not convinced. All right. We take the uterus from here, and then usually we take the fallopian tubes now, when we do a hysterectomy, and that's really important if you're ever having a hysterectomy to know this, because we now understand that ovarian cancer actually arises out of your fallopian tubes. This may sound kind of crazy, but this is really true. Every month when you ovulate and pop out an egg, the ovary opens up that capsule, and some of the cells from your fallopian tubes can fall into your ovary. And we now know that one of the most aggressive forms of ovarian cancer, the kinds that's associated with BRCA mutations and everything else, actually come out of your fallopian tubes. If you have a family history of ovarian cancer and things like that, you want to make sure that somebody, if they're going into your belly to either tie your tubes or something like that for a tubal interruption, or if they're doing a hysterectomy, that they actually take your fallopian tube completely out. Okay, so that's, I've got so much to cover. I'm going to keep going. So that's some basic anatomy, and I can answer any other anatomy questions. All right. This is what it looks like when I look inside. So I do laparoscopic surgery. When I put a laparoscope in through the belly button into the pelvis, I shine a light down. It's got a camera that projects on a TV monitor for me. And this is what a uterus looks like. These are the fallopian tubes, and these are the ovaries on either side. That's a really normal image of what a uterus, tubes, and ovaries look like. It's not an infertility image. It's just the closest, best one I could grab off the internet. All right. Next. In order to understand what happens when women have periods, you got to understand basic physiology, like what's happening in our bodies. So what happens as we go through puberty is this little area of your brain called your hypothalamus. I always say it sounds like your hippopotamus, but you don't have a hippopotamus in your head. It wakes up at puberty and it starts sending these signals to your pituitary gland. You stuck your finger in your nose into your brain, you hit your pituitary, but don't try. Your pituitary is like a hormone signaling center. So what are hormones? Hormones are just DMs. They're just messages that go from one place to another. And as I say to my teens in my clinic, just like you can DM your boyfriend and it doesn't go to your mom, hormone signals are just really specific. They go from one place to another. So your brain wakes up, sends a signal down to your ovary and says, hey, make some estrogen. So your ovary starts to make estrogen, and that's what makes the lining of the uterus grow. It gets up high enough, and your brain goes, so wait, that estrogen means there's a perfect lining to have a baby. So your brain sends this next signal to tell you to ovulate or pop out an egg. When you do that, you can actually have bleeding into a cyst in your ovary where the egg is. Has anybody ever had a hemorrhagic corpus luteum? Okay. What that means is where you pop that egg out, you form a cyst called a corpus luteum that makes estrogen and progesterone to keep that lining going. Progesterone is progestation to support a baby. Well, that little place where that egg was is super important because progesterone is what keeps the pregnancy going. So it gets this great big blood supply all around that cyst. It's got more blood supply per square inch than any other part of our body right after we ovulate. Well, what happens is every now and then one of those blood vessels pops. And guess what happens if you have a bleeding disorder? You really swell up. It can swell up so much you actually pop through it and end up with surgery. And I've operated on people with von Willebrand's and other disorders who bleed through a corpus luteum system and pop their ovary. That's pretty rare. Usually, most of the time, it just fills with blood and then gets better. But that, when it fills with blood, I'm not that excited. I'm sorry. What can happen? It feels like you've been kicked in the nuts if you're a guy. Excuse my language. Because we have our gonads on the inside, our ovaries. Guys are on the outside, right? Which are a little more protected. But when you swell the capsule up, it causes severe pain, double you over. You feel nauseous like you're going to puke. That's a hemorrhagic corpus luteum. That's going to get better. What happens is for about 2 weeks, you keep making this progesterone. If you get pregnant, the fetus, the placenta actually, the placenta makes a hormone called HCG. Any of you who've ever been in the hospital for factor infusions and anything else, they're always checking your HCG levels. That's what we find in your pee if you're pregnant. It's actually made by the placenta. And it looks just like the signals from your pituitary gland, and it tells your ovary, okay, keep making estrogen and progesterone. There's a baby in there. That's why you don't get your period when you're pregnant. But if there's no HCG, the ovary says, I guess I'm not needed. The hormone levels drop. And for those women with a bleeding disorder, that's when your problems start. Because it's when that hormone level drops that first you make these things called prostaglandins. Prostaglandins are evil. Prostaglandins take your uterus, which is just one big ball of muscle, and it causes contractions. It also gives you, that hot flush, that feel disgusting feeling on my period? Those are prostaglandins. Then you start bleeding because the prostaglandin contractions shear the lining off your uterus. Well, when it shears it off, you see these lovely blood vessels sitting right there? That's what's sitting underneath them because we have to have blood vessels that regrow the lining. So as it shears it off, if your blood doesn't clot well, that's why you bleed heavily if you have a bleeding disorder. Does that make sense? Then what happens eventually is your brain goes, okay, we need more estrogen. And so once you start, this doesn't work that way, once you start making estrogen a few days later, you start to heal over those blood vessels. That's why the estrogen itself can be healing because it helps regrow and cover the blood vessels back up. Everybody okay with that basics? Are you with me so far? Okay. All right. So this is a little, if it works, we'll see. I don't know. It's a little video. Oh, maybe. So here's your brain sending your signals. Now, when you first start your period, your brain goes up, the estrogen goes up, and your brain goes, oh, I'm so tired, that's enough. And you don't actually ovulate. right? So estrogen goes up and estrogen comes down and you bleed more often. Some girls, when they first start their periods, will have really frequent periods. And you know, the other time this happens, women in their 40s. So as you get closer to menopause, your brain signals and your ovaries don't work as well. So you can also not ovulate regularly and your periods can be irregular or closer together. And that's why. Once we get older, it works a lot better. Now, when you're not ovulating regularly, and there are a lot of things that can cause you to not ovulate. This has nothing to do with actually your bleeding disorder. What can happen if your thyroid's not working well, if you rapidly gain weight at puberty, if you have something called polycystic ovary syndrome, which has nothing to do with your bleeding disorder. If you're not ovulating and shedding once a month, if you're building up the lining, building up the lining, building up the lining, you'll shed irregularly all the time, that lining. That's why when people are having prolonged bleeding lasting for months, it may not be your bleeding disorder. It may be that you're asynchronously, meaning little bits at a time, different parts of your uterus, shedding the lining of the uterus. What happens then is that all of a sudden the brain goes, oh, wait, I was supposed to ovulate, silly me, and you ovulate, and then everything drops off at once, and you have this torrential heavy bleed where you come into the emergency room and you're flooding out everything. And can people with bleeding disorders not ovulate regularly? Yeah. So when you tack an ovulation on top of a bleeding disorder, then it makes things worse. Who are my people who don't ovulate regularly? Well, sometimes it's my adolescents. The HPO axis, that whole communication system, sometimes it doesn't communicate well, as I tell my teens. Just like sometimes you don't listen to your mothers, sometimes your brain doesn't listen to you. So the cycles of hormones don't work as well sometimes. Adolescents, do they sleep well at night these days? No. Or no? Do they stay up on their phones? Yes. Do they get stressed out? Do they gain weight rapidly? Do they have life that just happens? Was COVID a hot mess for this? Absolutely. So this kind of picture on top of the bleeding disorder can be a real problem. Okay. I do think it's important to track your periods, but I think it's very important to be careful what app you use. There are apps that send your information to the World Wide Web all over the place. Did you know that Flow shares its information with Google?
That came out.
Yeah. Did you know that the state of Missouri was tracking women who had irregular periods and asking them if they were having abortions?
Yeah.
Yeah. Look it up. I'm not making this up. So if you're going to track your periods, know your app. I would strongly advise using the Clue app. It's out of Oxford and it's out of Stanford. It's good and it keeps your information private. This is even more important for my adolescents, right? I don't think anybody should have anybody's period information but a woman herself. Okay, so be very careful. Also, there was a question. So what's a normal amount of bleeding? And these are actually defined by the International OBGYN Society, FIGO. Normal is about 3 to 6 pads per day for 2 to 8 days, with a cycle length of somewhere between 25 to 32 days. Okay? So when do we count cycles? It's from the first day of bleeding, from one period to the first day of bleeding of the next period.
Can you say that one more time? Sorry.
It's the first day of bleeding from one period to the first day of bleeding with your next period. It's not the end. It's not from here to here. It's from the first to the first. It's the day your period starts. Now, when you have a bleeding disorder, you can bleed regularly, but really, really heavily, or you can have irregular bleeding in between. Because one of the things I didn't put up there is when you ovulate, the estrogen drops just a little bit. So some people will have mid-cycle bleeding, will have bleeding right when they ovulate every month, because their body's just that sensitive to it.
Why is 28 now? Yeah.
Well, 28 can be, but 28 is the most common, but this is to a 27-day cycle, from the first of the month to the 27th of the month. But see, this is really funny. I have patients come and say, I have a period twice in a month. Well, yeah, because there's 31 days in the month. Your body doesn't know which day of the month it is. Your body doesn't know if it's June or August or February. Your body just sees the number of days. And there are different times in our life where our periods tend to be shorter and closer together, like when you first start your period and when you get to menopause, and when you're in the middle, it can be like in your 20s and 30s, it tends to be more regular. Dr. Davis was right. If you say you're bleeding too much, it is too much. So what are the general rules that I ask? Are you bleeding more than 5 pads a day? Are you flooding through your clothes? Are you flooding through your sheets? Are you soaking onto the bed? The most important one is, do you sit on the toilet and do you gush blood? Tiene un chorro de sangre, right? For this Spanish. If you gush blood, it's not normal. Yes.
Okay, what about the clots? Because
Clots bigger than a
I
quarter.
will drop like golf balls.
Yes. And do you pass clots bigger than a quarter? Bigger than an inch, right? Any clots bigger than a quarter, gushing blood is the most sensitive though for a bleeding disorder, right? Now, everybody, when we lay down in bed and we stand up in the morning and the blood's pooling in our vagina, yes, more blood comes out. But if you routinely like just are like sitting down there and it just feels like it's coming out, that's not normal. Yes.
How would you count if you wore tampons and pads, like in that number counts?
Well, it's the same thing. If you're having to change a pad or a tampon more often than every 2 hours, I also like menstrual cups and all kinds of different things. So there are, I didn't have them up here, but there are different ways to do this. This is the pads, and I have that up there. But there are ways to look at menstrual cups now and ways to look at tampons use, and I keep those in my clinic for everybody. So if you're changing pad products, a pad or a tampon every hour on your heaviest day, that's not normal. A menstrual cup, now most of them hold about 80 cc's of blood, and that is supposed to be how much you use for a week. Right, I know, yes.
When you say, are you talking about a regular size tampon, not the supers, not?
Well, you know what, for me, if you're needing to use super pluses every 2 hours, that's not normal. Now, if you're putting a super plus in and it's lasting all day, go you. You should change it every 6 hours, you're gonna get toxic shock, but it's okay. Now, another word about tampons. Tampons are safe to use. I live in Miami, and there's a lot of myths about tampons, like you can't use tampons if you're still never had sex before. I'm not gonna use the B word, I don't like the word virginity because there's no such thing as virginity testing. Newsflash, you cannot tell if somebody's a virgin if they're past puberty. You just can't, the hymen is open. So you can use tampons even if you've never been sexually active. And I think that's really key for women with bleeding disorders because you do tend to bleed heavily and you want to be able to use protection that lets you stay in the game at school, in sports, and everything else. All right. Yeah.
To back up, what you're saying is that our use a tampon and you won't lose your virginity.
Correct. Let me say that one more time because, yes, I get this all the time. I'm in Miami. It is a very conservative, yes, you do not lose your virginity using a tampon.
That's fine.
You lose your virginity when you have sex, however you may define that. Okay, but there's a big difference between a tampon and a guy's erect penis. Can we just say this out loud? Okay, you do not lose your virginity from using a tampon. They are soft and they just come out. Right? And the hymen in general is really open, much more than a lot of people think. I told you I'm no filter. You can keep asking the questions. I love this because I love to bust myths that are really pervasive in what we do. I love that we're having the revival next door. They probably will die. All right. So, but there are people who are just not comfortable using tampons or putting things in their vagina. I have girls who are like, oh my God, I can't touch that. You're sexually active like that. I'm like, really? Okay. But there are a lot of options out there that didn't used to be. For example, period panties. I put things up there. There are others. These really work. They absorb a lot of blood. Some of them 8, 10 pads worth. You know what this is really huge for? This great for kids with, for girls who have autism or others, or other disabilities where they can't stand the touch of a pad. If they've got skin sensitivities, if they've got, if they can't change their pads easily, if they've got mobility issues. Period panties are great, but they're also great if somebody doesn't want to use tampons, they play volleyball. Have y'all seen those volleyball shorts? How are you supposed to do that without showing your pad? So, I mean, these are really good. Yeah, and you can buy them on Amazon and even Target. Yeah.
What?
You know, that, I don't know, because tampons are in your vagina. They're not up inside your uterus. So they shouldn't cause more cramps. You have to, when you put a tampon in, put it in correctly, make sure it goes past the little muscles and inside actually your vagina. Your vagina doesn't have nerves usually in it. Now, tampons don't block blood from coming out too. That's a myth. People think that if I put a tampon in, I'm blocking the blood from getting out. No, the tampon's absorbing the blood that comes into your vagina. It doesn't do anything to block the blood inside your uterus. That's a key to understand. A lot of people worry about that. No, it's okay.
Yeah.
It's fine. That's just where it sits. These are menstrual cups, and these sit right at the opening to your cervix. These are for anybody who's tired of making a landfill of our hygiene products. You can use menstrual cups. They are reusable. They're good for up to 3 to 4 years. They used to be expensive. Now they're $8 to $10. Yes.
How do you get them out without making a giant mess?
You do the shower, so they're tricks. So yeah. So if anybody's from the generation of diaphragms, this is not unlike that. But you fold them in quarters and you pop them in your vagina, you twist it, and it makes a little seal. And then you have to break the seal by putting your fingers in your vagina and popping it and pulling it out. And yes, you can still use these too, if you've ever been sexually active. But it's a little tricky to do it first. Do not try to do this at 8:55 when you have to be somewhere at 9 o'clock. You want it's like the first time you use tampons. You don't want to do that in a hurry either. You want to be able to stand on the mirror, see your vagina, get it in there. To take them out, I either recommend doing it in the shower, or if you're like out and about, you gotta do a lot of traveling. These things were great. But you want to change them. You want to go into the handicapped room in the bathroom stalls and change them there. Because otherwise, if you're gonna pop the cup and you're gonna go rinse it out, you're not carrying it to your bathroom like this. You know, okay. But I usually just say change it in the bathroom stall where the handicapped stalls have their own sink in them. But they work. There's also discs now that look like the old diaphragms that cover up the cervix. A lot of women like those because you can keep having sex on your period and the blood doesn't make it mess all over the sheets. But there it is. Right? Yeah, they're great. They just cover up the cervix. Okay? So you can do that. If you're having cramps, some people think that having sex makes their cramps better. Whatever. You do you. It's okay. You know, it's true. Humans are great. The variety out there is amazing. There's a wonderful series on Netflix called The Principles of Pleasure that I think all women should watch. It's really well done. Okay. Those are the yes.
Maybe it's also I heard that using tampons affects childbearing.
That's absolutely not true. Tampons do not affect childbearing. They do not cause cancer. They do not cause birth defects. They are a sponge inside your vagina, and all it does is absorb the blood. And if people are worried, they can get the dye-free, unbleached, organic tampons if you're worried about that. But there has never been a single association of tampon use to any birth defect or any cancer or any infertility. But you know, again, these things die hard. Like, oh my God, this virtual child's gonna put something in her vagina. Yes.
You just have to change them, right?
Yeah.
Or else they-
You have to change them every 6 hours, and I recommend you don't sleep in them. Questions? Yeah. Heck yes, they do, and I'm getting to that. Okay, do I need help with cleaning? I got a whole slide on that. Yes.
This is in general, but are panty liners okay to use?
Yes, panty liners are okay to use. There are some people who absolutely can't stand the fact that they've got a vaginal discharge and they want to wear panty liners all the time. Knock yourself out. I live in Florida. I know where you live, but it's 100 degrees and humid. You wear panty liners all the time. It's hot and sweaty down there, okay? Because they have plastic on the bottom. Whatever makes you happy is fine. They don't cause harm, except if you buy the ones that have a lot of perfumes and fragrances in them, you're putting a lot of chemicals right there that can sometimes be irritating. So you get hot and the tissue is a little bit more sensitive. And so I always recommend the dye-free, perfume-free, and also along those lines. It is a multi-billion-dollar industry to tell women that we're not fresh enough or clean enough, or we need to have honey pots and summer's eve and all this other stuff down there. The number one thing that women Google is, why does my vagina have a smell? Do guys Google, why does my scrotum have a smell? Does it smell like roses? That's my case. No, but women, it's normal to have a vaginal discharge. It's how the vagina cleans itself. Sometimes when you're in the middle of your cycle, it's clear. Sometimes if you're outside your cycle, it's white. If you're right before your period, it can be yellow. After your period, it's yellow. It's normal. That's how your vagina cleans itself. That's not a sign of anything wrong. If you're having itching, burning, or a really strong, like fish smelling odor, that can be bacterial vaginosis or another infection. You'll need to go to see your gynecologist. But you don't need to use a lot of cleaning products. Down there, we are having, it's Dove, bar soap, and water are the safest things for you to put on your products. Otherwise, it can cause a lot of irritation. There's a lot of marketing out there that's frustrating. Yes. Much, I mean, seriously, sorry. The pH balance, your vagina balances its own pH. It's, you know, we have lactobacillus in there that are acidifying your vaginal pH. It's supposed to be, that's what keeps BV in this away. Yes.
So does a hysterectomy affect pH that contributes to PV?
No, because the hysterectomy is removing your cervix. Now, the difference is when you have sex and when you get your period, what happens is the semen and blood are all basic. They can change the pH, and when they change the pH, that can increase and allow the bacteria to grow. So if you have really heavy periods and have BV and then have a hysterectomy, you may get less BV because your pH is not changing anymore because the blood isn't there.
So what is the opposite?
Then you may have been colonized with a bacteria, with Gardnerella or Hemophilia or one of these other ones. If you've taken antibiotics and it's killed off the good bacteria, they usually keep them away. So sometimes you need a reset of the bacteria, not necessarily from the hysterectomy. That's really loud. Nothing we can do about that. I know. They're probably dying with what I'm saying here too. That's all I can do. Yeah.
How purpose. I was told my daughter, I can't give her a bubble bath after
Correct.
because it'll throw up the pH levels.
No, it's not. No, you shouldn't give her a bubble bath ever. Bubble baths, yeah, bubble baths don't get into your vagina. They don't change that, but they cause a lot of vulvar irritation. I have a whole clinic full of kids with bad reactions to bubble
And
baths.
at what point can she start taking those again? Because she
Should just use water, stay away from water. It's these perfumes and the soaps and things. We have a lot to cover.
We've got 20 minutes left.
Okay, let me cover the
She's
bleeding.
got a lot of slides.
Right, let me cover the bleeding, because that's why, here's the bleeding comments, okay? All right, thank you very much. All right, I love the Disney princesses at the gynecologist. All right. So why bother taking control of your bleeding? To prevent anemia and iron deficiency, to decrease your need for a blowout factor, right? To enjoy sports, vacations, and relationships, and because we can, right? Because we can. All right, there's two ways to control your bleeding. The first are things like factors, tranexamic acid, that help stabilize the bleeding, and you only take them when you're bleeding. And you can use tranexamic acid every month with your period. You can use, it works better than Anacart in the uterus, or you can use your factors. But there are hormonal ways too. How many people in the room are afraid of hormones? Wait, right. So there's a lot of people. But so let's talk about these fears, because these fears, there's really good data to show how safe they are. But TikTok, especially right now, makes it sound like they're the most evil thing in the world. It really is out there on social media. It's going to make me fat, or it's going to make me moody, or it's going to give me cancer, or it's going to make it hard to have babies later. And there's a lot of myths that are about them. There are truths as well, and I'll go over all of them. there are lots of different ways that we can manage this. Okay. So. This is crazy next door. Alright, so. First, let's talk about progestins. Progestins are a synthetic form of progesterone, which is what we make in the second half of our cycle. There are forms that are not contraceptive. I like to use one called norethindrone acetate for ingestion. It's my all-time favorite. It's used to, what it does when you take it is it makes the lining of the uterus really thin, so there's nothing to bleed.
This is pre-hysterectomy.
This is, yes, you don't need this if you've had hysterectomy, okay? Norethindrone acetate's been shown to be effective for endometriosis, it prevents bleeding, it's not associated with blood loss, there's no increased risk of cancer. Medroxyprogesterone is Provera, not the depot form, but there's an oral form of it as well. And then there are natural progestins. The problem with natural progesterone, and I'm all about natural and everything, is that your body doesn't absorb it well. It's not bioavailable well, so it doesn't work as well to control bleeding as our synthetics. When we use these at high doses, you can have weight gain. So I try to use as little of these as possible to control the bleeding. But in my experience, in the last 30 years, these are the most effective ways. Somebody says, I don't want to use birth control, but I'm going to use hormones to control the bleeding. They don't increase your risk of blood clots. They lower your chance of uterine cancer by about 80%. So they're very effective for that. Yes. So in a patient who has a bleeding disorder that wants to get pregnant, I usually use tranexamic acid. And if I need to, cyclic progesterone, not the continuous suppression. Because the continuous suppression will cause them to not have the odd signals for ovulation. Okay? But you can't cyclically use it. Woo! Okay. Why do we use birth control pills and how do they work for birth control? And how do we use them? Why do we use them to control bleeding? Birth control pills have estrogen and progesterone in them. And the way they work for contraception is they tell your brain chillax. You do not need to send the signals to ovulate. The hormones are already here. It's not killing eggs. It's not killing sperm. It's just turning off the brain signals that do that. What happens when you take them to control bleeding is that the progesterone does thin the lining of the uterus out, but you need a lot less of it because the estrogen stabilizes it a little bit more too. So it allows me to use less progesterone, less hormone when I use the estrogen. The other thing is that the estrogen clears my patient's skin, prevents acne. And so some of my patients use continuous birth control. So what does this look like? You can use birth control pills, usually come in packs that have 3 rows of the active hormones and 1 row of placebo. In my patients with bleeding disorders, I tend to use it skipping the placebo pills and starting new packs. So it's called continuous use. The problem with anything you use continuously, whether it's progesterone, whether it's a ring, whether it's a contraceptive patch, is that after a while, sometimes it makes the lining of the uterus so thin it becomes fragile. And then you end up with irregular bleeding. Then you need to take usually a few days off, let the lining shed and reset, and start it all over again. But many times we can just do a reset and it works really well. There are progestin-only birth control pills out there. They tend to be really low dose. But they're so safe, they're available over the counter now. So you can buy Opill without a prescription on Amazon, in Walmart, and there's even patient assistance programs if you can't afford them. Again, these just prevent ovulation. They are not abortion pills. And if you have somebody who's lost your insurance and don't have access to anything else, these are, or you haven't seen a doctor, you can safely use Opill. There are no contraindications to it at all. We have fought so hard to get over-the-counter birth control in this country. Now, there are other forms that are prescription-based as well, very low dose. It's just they're so low dose that sometimes they're not enough to stabilize everything. Justin I talked about, which sounds similar. Depo-Provera. Depo-Provera has pros and cons. It's the strongest form of progesterone you can get. And it's a shot that's usually about every 12 weeks. Sometimes I have to give it every 10 to control bleeding. Depo-Provera does have some weight gain associated with it. And after many years of use can decrease your bone density, although that's reversible when you stop it. I try to use this as a second tier in patients who can't remember their pills, like let's talk about some of my teens who can't do that, as a bridge until they get to a place where they're better at doing it. And sometimes this is the best possible thing that works for them. It's an option. It, again, suppresses bleeding. But if you ask me now, today, in 2024, what is my all-time favorite? It's an IUD. Why an IUD? The progesterone IUDs, like you see here, are the size of a paperclip. They go inside the uterus and they control the bleeding at the uterus. They don't have as much systemic hormones, so they keep your total hormone level low. And they keep most of the hormones inside your uterus. This is not the copper IUD, which makes people bleed more. So don't use that if you have a bleeding disorder. But the progesterone ones reduce the amount of menstrual blood loss by 90%. That's huge, and you don't need to take a pill every day. I've got patients as young as 12 that I put these in the office. I put numbing gel on the hymen just so they can tolerate the speculum. I do a cervical block. Make sure that your doctors give you medicine for pain. It's been years of women being gaslit saying, it doesn't hurt, it hurts like hell. No, make sure that you get medication to help you with pain, whatever that is. I play music for my patients. I've done these to Drake, Rihanna, you name it. And it can really be a game changer. 95% of the time they stay in place, about 5% of the time they get expelled, and I've had to replace them. They're not perfect. But they really are so much nicer because if patients are having side effects like weight gain or mood or whatever, they are so well tolerated. And they actually are indicated for treatment of heavy bleeding now. So sometimes we have to fight the insurance companies for this, but Mirena and Liletta both have FDA clearance strictly to treat heavy bleeding because of this. So, any questions about IUDs?
How long does it last?
All right, so a Mirena lasts for technically 8 years for contraception, but 5 years about for bleeding. It tends to wear off.
Did you notice any increase in bleeding after they were removed? I had one for 5 years before I had my hysterectomy. I had mine removed, left for 3 months, and then had hysterectomy.
It's not probably from the Mirena removal that you had. It probably unmasked what your bleeding pattern was.
Okay.
So
I didn't have a period the whole time I had.
right, exactly. And it's not that you built up blood. You weren't burning lining. But what happened is when you took it out, you lost your control.
Oh, makes sense.
And so it unmasks it.
And I did not get drugs. It was more painful than giving birth without.
Yeah, exactly. So I'll always insist on getting drugs. So what do I do for IUD insertions? I do a cervical block always. You can use pain medicine. Planned Parenthood and other places now are doing sedation. Yes.
How is a block safe in a bleeding disorder?
So I use epinephrine in my block. And the other trick that I have lidocaine with epinephrine. It's numbing medicine to the cervix. So I've got epi, so it causes vasoconstriction, so it doesn't cause a problem. I pre-medicate my bleeding disorder patients with tranexamic acid right beforehand, so I have them take that. And instead of grabbing the cervix with a tenaculum, so if you've seen online what that looks like, I grab it with an Alice or a Babcock or something to stabilize it that doesn't dig into the cervix.
And then what do you use for when it's, my daughters have 2 of them.
Uh-huh.
She has bleeding disorder.
Right.
But they both migrated because her anatomy is so small. They weren't staying in the right spot. So now they said she can no longer get that.
Did she get a Kylena or a Mirena?
Mirena.
So there's a smaller one called a Kylena.
They did the smaller one.
That's the Mirena's bigger than the Kylena, but
Both of them migrated.
and that can happen. It's not just because her uterus may be small. Sometimes people expel them. Sometimes the uterus says, I don't think so, and pushes it out. It's not perfect, but it's a great option for many. Yes.
Okay, so going through that though, in Idaho, we have access to mostly men, OBGYN.
Yeah.
So how should we go by talking to our male OBGYNs
So-
who have no idea that it hurts because they were told it doesn't hurt?
Well, it does hurt. So what you do is you can say now the CDC finally has come out in its most recent this year, 2024, guidelines for management of IUD insertion, saying that it is advised that you can use pain medication for IUD insertion.
You can use, but they still, like, they don't, that's the thing.
Then I would vote to speak.
Yeah, side of it, they won't do it, so how as women are we supposed to ask?
I have-
that?
I would say advocate, and I would say I would like a cervical block. Because they know how to do it. Every OBGYN does cervical blocks for removing abnormal cells on the cervix for a leak.
Oh, absolutely.
So just,
They won't.
I wish I could, if I could control the OBs in Idaho, I'd be so good. Here's the data on them though. This is how much they truly reduce bleeding. If you look at how much, this is like up here, the Mirena, versus placebos, versus your TXA, versus birth control pills, it's really so much better reduction in bleeding. Okay. See, I knew these can go on for, so myths and facts about IUDs. IUDs do not cause abortions. IUDs do not cause pelvic infection. Gonorrhea and chlamydia cause pelvic infections. Don't tap until you round it. Sin gorrita no hay fiesta. Okay? Spanish. Don't have sex without a condom. Protect your little baby in there, okay? All right, not the baby lady. Okay, IUDs do not cause infertility. They do not cause ectopic pregnancy, and they do not cause cancer. In fact, we use them to treat cancer. There are certain, yes.
How often they get dislodged?
But they don't get dislodged during sex. They're inside the uterus, and the penis doesn't go inside the uterus. Well, it's got a really skinny thing. So, so it doesn't get dislodged during sex. Even if you're, yes, the uterus moves during sex, or it should. Otherwise, we're going to be miserable pain. But it doesn't get dislodged. It's within the uterine cavity. Now, can anything happen anytime? For sure. Okay. All right, I am not a huge fan of the implant in patients with a bleeding disorder. Why? Because we know that as a baseline, 20% of patients who get implants, the contraceptive implant, bleed heavier. Saying that, I've had patients with bleeding disorders where this works for them. So what's the bottom line? It's like your makeup, it's like your shoes, it's like anything else you wear. You have to find what works for you. And there may be a little bit of trial and error. And what you have to do is bring to the table with your doctor what your concerns are, what are your priorities. And that's the first thing I ask my patients. When you're coming to me for this, what are your priorities? What are your worries? Is it that I don't want to get acne, that I'm going to probably use birth control pills versus an IUD? IUDs don't cause acne, but birth control pills prevent them. So you have to kind of, when you go to your doctor, have your priorities listed out. And say, hey, I'm here for this. I have a bleeding disorder. This is what I don't want. This is what I'd like to try. And then it's a matter of trial and error. I don't get everything right the first time with every one of my patients. Far from it. But I try to take that journey with my patients together. Now, in the last few minutes, are hormones safe? Yes, but they're not for everyone. It's okay to use them if you have a family history of breast cancer. They actually prevent, in families with BRCA, BRCA1 and 2, they prevent ovarian cancer by 80%. And those people are at increased risk of cancer. But if you have an active mass, do not take hormones, okay? Estrogen can cause blood clots in women who have a clotting disorder, but y'all have bleeding disorder. It's the opposite, right? And again, we have to treat things as an individual. A couple really important concepts though. I hope everybody's heard of emergency contraception, the morning after pill, the emergency pill, Plan B. That is estrogen, and I'm a huge fan. I'm so glad. I'm sorry, it's progesterone. I'm a huge fan. I'm glad it's over the counter. It prevents abortion. All it does is prevent ovulation. If you take it right after sex, it prevents you from ovulating. It tells your brain, stop, don't ovulate, don't fuck up that egg. The problem is your progesterone goes up, and then your progesterone is going to go down, and you're going to get bleeding 2 days later. It may not be heavy, but it can happen, so be prepared for it. If you need to use emergency contraception, have your TXA have some factor around if you're going to do that, all right? You want to make sure that you have that. I would not use a copper IUD in somebody with a bleeding disorder. 5? Okay.
For more permanent, if you think about like the ablation, my doctor said it had like a 99% success rate. I failed and turned into a hysterectomy.
You're too young to have a 99% rate for an ablation. I can tell you right now it's going to be 40% because you are under 50. You're under 45. Yeah, of course you're going to fail an ablation. You have a bleeding disorder, and ablation tends to not work unless you are really close to menopause.
But you wouldn't recommend it at all for people with bleeding disorders?
And you have to be pretty close to menopause because you've got that estrogen and progesterone going, so it's pretty hard to get an ablation to work. If you were 45 or older, and maybe you're just really young, that's great.
I was 27 when I had that, and then 29 for a.
Holy sugar. So you could have had a Mirena and kept your uterus. That's frustrating. A 27-year-old, I would never do an ablation on it. It would never work.
You fixed my ablation.
It doesn't work in young people. You need to use because you're going to regrow the
You told
lining.
me that was my only option.
A Mirena IUD is such a great option. This breaks my heart to hear because what you can do from that is make sure that doesn't happen to anybody else. Ablations don't work unless you're close to menopause. I'm 15, praise the Lord.
Can I ask questions? And this is great, but I'm sure there's other information we need to cover. So can I?
Yeah. You can email me all the time. But yes, ablations, that's a really important point. I'm so glad that was brought up. Will not work unless you're close to menopause. Why? Because the tissue regrows. It's a regenerative thing. You can't ablate somebody in their 20s.
You definitely need to get that out.
Yes, gynecologists, because it's their tools, they're not thinking outside the box. Gynecologists are not experts in bleeding disorders. I'm working to change that,
So to speak,
so to speak.
not thinking outside the
Right.
something to say that.
Well, that's different. So let's talk about endometriosis, all right? Okay, wait. A couple of things. I assume that everybody in the room knows about Good RX for meds. Do you guys know that you can get birth control pills on New RX very inexpensively? That's another one. Amazon has emergency contraception, much less expensively. And Bedsider has great information about birth control. So when you worry about heavy menstrual bleeding, I love this chart because of course you can worry about bleeding disorders at any age causing your bleeding. But anovulation happens early when you first start your periods and late. Local pathology means like if you have a cervical cancer or something like that, because they can make you bleed. Any underlying bleeding disorders. There are all kinds of things that can make you bleed funny. Some things to think about, and I'm going to go through these things. What if why I'm bleeding has nothing to do with my bleeding disorder and something has stirred the pot in my reproductive system? Okay? So, first of all, gonorrhea and chlamydia can make you bleed. Why? Because it gets inside the lining of your uterus and it causes inflammation so people can bleed. Really important, okay? Don't tackle too rapid. Seriously, all right? Also, the set, friction can make you bleed. So if you're using condoms, go get some great lube. What is my favorite lube? Uber Lube. I owe nothing, no stock in the company, I wish I did. Uber Lube is amazing, it's silicone. Why do I recommend it? Because it's slippery and it doesn't mess up your condoms. Do not use coconut oil, olive oil, they eat right through condoms. They're oil, because condoms are latex, okay? But definitely use great lube. Once condoms are really great, you do not want to get rid for her pleasure because that increases your friction. You want smooth condoms, okay? All right, fibroids. Also called fireballs in your uterus. I used to have, I lived in Gainesville, Florida, which is the South for a while. Okay, so these are what fibroids are. Fibroids are benign growths of uterine muscle. By the time we hit menopause, about 50% of white women, about 70% of Black women can suffer from fibroids. And it does, or also leiomyoma is the other name for this. This does not, it's just, they're benign, But what happens is, when you grow these, they increase the blood supply to your uterus. So if you've had pretty well-controlled periods, whatever you've been doing, and you're entering your 30s and your 40s and you're having heavy bleeding all of a sudden, you could have fibroids that are growing. Because when you make, they're called VEGF, vascular endothelial growth factor, basically you get these huge blood vessels that supply these, and so when the lining starts to come out, you bleed really heavily. If you're done with having kids, this is a time to consider a hysterectomy, because while you can do a uterine artery embolization where you go up in there and you cut off the blood supply to your uterus with blood ablating, they can tend to grow back. This would be a really good time if you're done having kids to have a hysterectomy. Taking just the fibroids out, if you've got multiple fibroids, you've got a 70% chance of growing back. How much surgery do you want to have? So if you're not done with childbearing, you can go in and remove the fibroids. But I'd have your kids and then probably plan to get them taken out. One thing that I'm very passionate about is endometriosis. Endometriosis is when the lining of the uterus grows outside your uterus and inside your pelvis. It causes excruciatingly painful periods. I operated on a 13-year-old girl on Wednesday who had heavy, painful periods, who had big fungal Lagrange disease and tested positive, and screened her for that. But she also has severe pain with her periods, and every time she bleeds, pain down her legs, pain in her back. We did surgery on her, and she has endometriosis everywhere that I removed. I took it out, and it got better. So ablation of endometriosis does not mean ablating the lining here. It means frying or removing the endometriosis implants inside the pelvis. Why do I think women with a bleeding disorder have higher rates of endometriosis? Because the more you bleed, the more backflow of blood you get through your uterus and in your fallopian tubes and into your pelvis where those implants can occur. Menstrual suppression does prevent that backflow of blood, so it can actually help prevent endometriosis. We know that in women who've had endometriosis diagnosed, if you suppress their periods afterwards, they have much lower rates of recurrence. It's more complicated than that. There's probably something autoimmune, there's probably something systemic about endometriosis, but if you're having severe pain, the severe pain is not your bleeding disorder. If you're having severe pain and you're missing school and you're missing work and you're missing out on life and you're not able to do your regular activities, don't let somebody convince you it's just from your bleeding disorder. You probably have endometriosis too. And you need to get that diagnosed. We're starting to diagnose more and more women, even without surgery, by just clinically saying your symptoms sound like this, and you probably have this. But in my patients, especially my young patients, they feel so validated when I operate on them, and I say, yes, you have endometriosis, so they can put a name with it. The implants can be small, but they increase inflammation and they can dig onto nerves, and you can't see them in ultrasounds. So a lot of women said, I've been in the emergency rooms, oh, you're normal, your ultrasound's normal. It's in your head. Or maybe you were abused. I don't know what it is. No, you have endometriosis. And women need to be taken seriously, and we need to look for this. That's a whole other presentation, though. Yes?
Does adenomyosis, is that linked to bleeding disorders?
Not that we know of. Saying that adenomyosis is when this lining grows outside your uterus, outside the lining, and inside the uterine walls. It's incredibly painful.
I had it.
Yeah, it's
My
miserable.
daughter has it.
Yeah, and you can't have it young. And so IUDs in young people are right now the most effective way to manage it, although as you said, your daughter expels her IUDs, but I would at the very least use progesterone suppression. There's some newer techniques where some people at very high-end centers are coming in with ultrasound ablation with some very special techniques. There are very few places that actually do that, but there are some. Yeah, I've had a number of adolescents with adenomyosis too. We used to think it was only women after they had kids. And I know that's not true. I've seen it. Yeah. Yeah. It's really challenging. There's a whole video series. There's a wonderful documentary that we're screening with OBs around the country called Below the Belt by director Shannon Cohen, COHN, that talks about how women are not taken seriously, how these surgeries can be life-saving or life-affirming and can cause pain. All I can say is, don't give up the fight. The average amount of delay in diagnosis is about 10 years for endometriosis. It's really sad. Make sure that if you have pain and you're not being taken seriously, look for a doctor that advertises endometriosis care or specializes in endometriosis or minimally invasive surgery. And even after it's diagnosed, even after it's taken care of in the operating room, it's a multidisciplinary approach to care. It means using physical therapy for the muscle spasms that happen with it. It means using psychotherapy, sometimes acupuncture, sometimes gabapentin. It's a multi-pronged approach to manage endometriosis pain. Cervical cancer, everybody should be vaccinated against human papillomavirus. The vaccine is not a live virus, it's not a kill virus, it's an outer protein capsule of the virus. It's a vaccine that works. If you have a bleeding disorder, even having an abnormal pap and colposcopy, which can be incredibly painful, is a lot to go through. Yes.
Are there any age caps for being able to?
That's a really great question. We're starting to use it now, even in women who have abnormal paps, that without age restriction, to try and help the immune system fight off the HPV. In general, the younger age is 9. We usually recommend starting at age 11. I vaccinate my boys. It is indicated for boys. I actually, when I use the science of it, paid $150 per kid for sons to get the 3-shot series because I use the science behind it. The upper limit is now, they say 26, but there are people vaccinating 44 and older. If I were suddenly single, if my husband dumped me tomorrow, I'd be vaccinating myself. I'll pay for it. It's so effective for HPV. Okay. Why do I bring up the cervical cancer? Because if you have bleeding after intercourse and you've not been having that before, and you've not been screened for your pap smears, and you can have cervical cancer, that can be a cause of bleeding. I just don't want people to forget that this can cause it.
Is it true that you can still get cervical cancer if you've had your cervix removed because there's
No.
cells?
No, if you've had a hysterectomy, you're not going to get cervical cancer. Can you get precancer changes in your vaginal walls? Yes, it's less common, but yes, you can. And you can get it on your vulva as well.
Is that something they check when they do the anal exam? Is that same?
Most people who've had a hysterectomy for reasons that are not abnormal cells, so not for cervical dysplasia, their doctors don't do that test. They don't do it when they look inside your vagina. You have to ask. And so this would be what I'd say. If you had a bleeding disorder and had a hysterectomy at a very young age for your bleeding, but have had new partners, you're young, you've got a new life, and you've never been screened before, I would have at least one screen to check for abnormal cells in the presence of HPV. There's actually self-testing now that has come out and approved by the FDA, so if you don't want to have a pap smear, you can test your own vagina for HPV. And you do it, yes.
Myth or fact? Having multiple sexual partners throughout your life can cause cervical cancer.
Indirectly true. So this is how HPV, so let me explain. HPV is spread from skin to skin contact. There's no condom big enough to cover a guy's balls, so can you get contact during sex? Yes. All right. Excuse me, I talk really straight. So if you have multiple partners, you statistically increase your risk for exposure to more and different types of HPV, which was now known as the causative agent of that. Saying that, if you have one partner and that one partner has HPV 16 or 18 or one of these aggressive strains, you end up with cervical dysplasia. So I think it's really important that we not shame women who have had abnormal paps or have cervical cancer and think that they're promiscuous because it just takes one penis, because guys, you can't test for HPV, that's got one of those nasty strains that can cause HPV. Guys have no symptoms, no problems from it. And so there's no way to know. Yes.
There are multiple different strains.
Yes, there's about 50 different strains of HPV. The current vaccine, Gardasil 9, protects against 9 of them. 2 that cause genital warts, which are not precancerous, but just, you don't have to look at those. And then, or treat them. And they affect your self-esteem. They don't affect your risk for cancer. And then the other 7 are the highest frequency HPV strains that cause cancer.
So how do you get the vaccine though if the state isn't offering it?
It is offering it.
Well, how though? Because
It's in every doctor's office and it's in every health department.
I asked for it though. They said, oh, you're not of age.
Well, you're too old, is what they say, because you're over 26.
Right.
Yes, and so they'll say, no, you can't get it because you're over 26, and so you say, how much does it cost?
Oh, okay.
Right? Because you can get it at CVS and Walgreens. And you know what? It's not cheap. It's not cheap, but you know what? If I thought I would be at risk,
I heard something important
Yeah.
that you said, and if my takeaway is correct, so I've actually even heard from women who've had hysterectomies that they no longer go to
gynecologist.
gynecologist,
Yes.
and if I'm getting the message, they should absolutely be going.
Well, so if you've had a hysterectomy and you've never had, and you don't have increased risk for cervical dysplasia or anything like that, you don't need to have cervical cancer screening or pap smear screening of your vagina. But there's a lot of reasons why I see patients that have, this is one before I just did when people see gynecologists. If you're having pain with sex, if you're having new onset bleeding, if you're having abdominal pain and you think you might have ovarian CA or something like that, I think sure, go see your gynecologist. Yes.
This might be a stupid question.
No, that's a good question.
But like cold sores and stuff like that, does that increase? Because it's all that kind of virus, right? Or is that like? a
No,
different
cold sore
strain?
virus is herpes 1.
Okay.
And 80% of all Americans have herpes 1. Now, there are some of my patients who have oral sex and get herpes 1 down there.
Yeah.
It's agony. It's the worst blistering ulcerative hot mess that there is. I feel so bad for them. We can treat it with valacyclovir and it gets better. It's okay. Herpes 2 is what we consider classic genital herpes. We can keep those under control now very easily with valacyclovir. It doesn't interfere with your pregnancies. It doesn't, you can even have vaginal deliveries now. You can just suppress people with valacyclovir. I really want to get rid of stigma related to herpes.
So that's different. Like if I oral sex and
Yes.
gave them, it would be a different strain than the like.
No, if you have HSV1 and you had oral sex, get somebody or HSV1 for oral sex, they would have HSV1 in their genitals.
Okay.
Yeah, it's all right. You can control it either way.
So I'm confused. So I had a hysterectomy. I've had abnormal pap smears. I'm high risk. And so
You should get the HPV vaccine.
I agree with you 100%. But when I call my gynecologist, they say you don't need an appointment. You had a hysterectomy. There's no reason for you to see us.
That's wrong. Go see your gynecologist.
Yeah.
All right. I'm gonna say in the last minute I have left. I want to say a word about abortion, if that's okay with everybody in the room. I always prefer preventing pregnancy to having abortions, regardless. Abortions are painful, stressful, miserable, in the worst, in the best of circumstances. Even women who seek them knowingly wish they didn't have to go through that. So I'm going to lay that all out there. But as a gynecologist, I take care of women who have contraceptive failures, women who've been raped, and women who do something stupid, like they have sex without, and I say that with love because I've done, who in the room has not done something stupid in their life, right? We all have. The abortion pills that are available by mail order, if you live in an abortion restricted state like I do because I live here in Florida, work by interrupting an implanted pregnancy. That is not the same as emergency contraception. And I'm glad that they are available, but if you have a bleeding disorder and you use abortion pills, you're going to have a heavy bleeding when you pass that pregnancy tissue. And it can be really embarrassing, and there's a lot of stigma associated with abortion. I think it's important that you know and you consider very strongly if you need to have an abortion, that surgical is probably safer if you have a bleeding disorder because it can be controlled. When we say surgical abortion, it's done with suction. I'm saying this because I do believe that there are circumstances where we need to take into consideration the underlying medical conditions of our patients. There are medications that some people take that cause birth defects. Currently in our state, we're not allowed to do a termination for birth defects. You can't even see them. until it's past the abortion limit is 6 weeks. Why am I bringing this up? I think everybody in their own heart has to make their own decision about these kinds of things, but our current restrictive laws really are very much impacting women's health. And I say this as a gynecologist. I hope nobody in the room and nobody you know needs to ever have to have an abortion. Or if they choose not to, then God bless them. That's awesome. But I think that there's a lot of things that people may not understand. So that if you have a factor deficiency and you find out at 9 weeks gestation that you have a baby that's got a really terrible birth defect, you don't have choices unless you go up to Virginia from Florida.
Then it's illegal to travel.
It's not illegal to travel right now out of Florida, but certain states do have travel restrictions. In some states it is. Yes. So think if these things are on your ballot, very critically as you choose your voting. I'm not trying here to talk politics. I'm just trying to say that it's complicated for people with underlying medical conditions in a way that doesn't necessarily work for broad laws across the board. And I hope that that doesn't offend anybody. I don't mean to get that to.
No, that's the first time I've heard that too, like, that's speculation, like, these are the topics I've never heard before.
People, it's tricky, you know, I'm going there with tiptoes because I really don't want to offend anybody's personal beliefs, their religious beliefs, their personal convictions. Yes, ma'am.
So I didn't realize that a DNC after you've had a miscarriage is considered an abortion.
Well, it's not.
Oh my God.
It's not. It's not a medical abortion. If you've had a miscarriage, it's not technically in gynecology, any pregnancy loss is considered an abortion.
Right.
It's gynecology terms. We're trying to use the word miscarriage when it's spontaneous, more so that people don't feel like they're stigmatized, although I don't think there should be anyway. But the same procedure that is done when you have a pregnancy loss from a miscarriage is what's done for a termination surgically. And they're called a surgical abortion. And it can be done for people who have all kinds of medical complications. So there are safety considerations there. In certain situations, surgical is much safer than medical. I think medical will continue to be made available, but I definitely think that in the bleeding disorder community, if you have friends and family with these disorders and they have an unplanned pregnancy, I want the word to out that they need to be careful about those medical abortions, that they need to have their factor, that they need to anticipate they're going to bleed heavily if that's what they're going to do, and that they have access to surgical is probably safer. And I hope I didn't offend anybody.
You know, this very delicately and educationally.
Yeah.
Thank you.
Sure.
Quick question, so when our patients come in after they've had a miscarriage, or when we find out that they're miscarrying, our providers will give them an option of either doing the DNC surgery or a pill.
If they've got a bleeding disorder, they should have the DNC.
If they choose the pill, I mean, what's the difference between having the pill to get rid of everything and the abortion pill?
There are two different medications that are used in abortions. Mifepristone or RU46 has very limited use, and it requires special physicians to prescribe, although we're trying to get rid of that. And what it does, if it's a progesterone antagonist, it blocks the placenta from growing in. It's usually used first. Misoprostol, which is Cytotec, it's actually used for ulcer prevention, causes uterine contractions and expulsions. It's actually a prostaglandin kind of medication. And both of them can be highly effective in combined together. And we have them in our emergency room at Jackson to help somebody who's had an incomplete pregnancy loss, they've had a miscarriage, they've got still tissue, to pass the tissue. They're both very effective. The issue is, if you have a bleeding disorder, you can't control that blood loss. Where if I have you in an operating room and I'm using a very gentle plastic suction, I can give you your factor. I can give you tranexamic acid. I can give you Metrogyl to contract the uterus down, and I can control the blood loss better. Okay? Yes, ma'am.
Will not in office, like in an emergency or in an.
It depends on the level of comfort of the provider. This is somebody who does it in the office with frequency and has access to tranexamic acid and other medicines, fine. It depends on the provider, depends on the gestational age. Further along in pregnancy, if somebody's having a termination, needs to be in the hospital, especially with bleeding disorder. But we've had patients with severe cardiac conditions lately, who pregnancy is fatal for them, have an unplanned pregnancy because of some reason, and we weren't allowed to do terminations, and they had to fly to Virginia. So there are things that I think people just don't know that we deal with.